norm. It has to be because, I take so many pictures of videos of nature constantly, and I don't want to delete it. Like,
Absolutely
this is
not.
my happy time.
Me too.
Okay.
All right.
So, ladies,
we can just get back into it a little bit. We already talked about aphasia a little bit, so you guys kind of have a background on it. There are a couple different types. And some of the things that might happen to you, you have trouble understanding speech, you may have trouble speaking clearly, trouble writing. This is something that you guys would know. Does anyone know the word for when you have trouble writing with that?
Dysgraphia?
Yeah, agraphia.
Agraphia. Dysgraphia would be, agraphia is you can.
Yeah.
Dys would be in trouble.
Okay.
D, all the above.
Okay,
So
true.
yes, everybody's
So yes, we're right. We're both right.
Yes.
So yeah, I just thought, I was like, oh wait, that one's, I might know. Okay, so there are two main ones, but there's a couple different. So there's Broca's and there's Wernicke's. So Broca's is kind of like that broken speech. So that is when when you're not that clear with what you're saying, but you know what you're saying. You don't have any issues understanding, you just have trouble with saying it. So like, it's hard to understand, your articulation's not that clear. Wernicke's, on the other hand, is you have difficulty understanding it, and then you're talking and you might not understand them whatsoever. Like, and they think that they're making like clear sentences, and they're not at all. So it's very interesting to see both. And then there's global. So there's the two different parts of the brain that you can do it, that produce language. So there's the Broca's and the Wernicke's. So depending on where the damage is how it's going to impact your speech. So when I ran my aphasia group, it was always really fun. So I would do role play activities with them so that they could, just something that you guys would probably do too, so functional ways of your life. So one of the ones that I did that was really fun is like, okay guys, we're gonna go out to dinner. And I would give them a roadmap every time of what we were gonna do. So we're gonna start out with questions. Then we're gonna get into drinks, apps, entrees, dessert, weekend plans. Kind of a visual schedule for them. They're older, they still benefited from it. So we'd start out with just an open discussion just to see gauge everybody where they were at. So what's your favorite cuisine? And what's your favorite one to cook? So then we kind of talked about it. Everyone was pretty much with it, and they would talk about it. Some of them were like, I haven't cooked in years, but when I was younger, I used to make this, and it was really just sweet. So we went through, and then I'd give them options. I'd have pictures of them, give them choices. Which one would you want? Oh, I think I want the penne vodka. So that they could practice doing this. And then I'd be like, okay, let's get dessert too. What kind of ice cream? Another one I did was I was in New York, so I was like, okay, we're going to go to a Mets versus Yankees game. Who are you rooting for? Okay, if you're rooting for the Yankees, which color or which shirt would you pick out? Do you like this one or this one? If you're rooting for the Mets, you want this one or this one? All right, you want to get a beer at the game? What kind are you going to get? So just very functional stuff to help them think about how they would communicate in their real life and places that they would go. So it was just really a fun thing that I enjoyed a lot. Sometimes there's an error that I have too. So that was a little tongue protrusion, your tongue sticking out, S turns to TH. I sometimes think about how I would still really like working with the older people, which is so beautiful that I can if I want to, but I want to get really good at what I'm doing now and stay here for a while before I make any other changes because, I'm still new at this. There's a whole umbrella of things for me to learn about, but this is just where I'm at right now. Okay. So now we're going to get into feeding a little bit. As I said before, that's not my favorite stuff, so bear with me. There's a bunch of different reasons why you might have a swallowing disorder, and that is called dysphagia. So we're going to look for, let's see what I have here. All right, so just to explain to you, does anyone know anything about the anatomy? Did you guys learn this or no? A little bit? Way back. Me too.
Back. Yeah.
So the main thing that I want you to know is that there's the larynx and there's the trachea, your windpipe and your swallowing one. Then on top of it is the epiglottis. So when you're breathing, all that air is coming through, it's going through your larynx. That's what houses your voice box. So you have that little leaf that hangs out on top. And when you're breathing, you're talking, it's opening, it's closing. When you're swallowing, it is closing. And that's covering that windpipe so that it can go down the other one. And sometimes it doesn't go all the way. That's how I got it down the wrong pipe and you feel it in there. That's not good, obviously. So there's different stages of swallowing. This is very wordy. I'm not going to read it word for word, but just so that you know, it starts out with oral prep, and that's you putting the food in. Then there's the oral phase. That's you chewing. You're supposed to go from side to side, form a bolus, which is a disgusting word for the ball of food that you chewed up mixed with your spit. Then there is the pharyngeal phase, and that's when it's going down your pharynx and goes past the esophagus and enters the pharynx. So yeah, basically it's a lot of words, a lot of stuff. It's very complicated and hard, and it's something that really scares me to do because I don't want to be wrong, I don't want to give advice wrong, and then there is aspiration. That's when it goes down the wrong pipe. There's also silent aspiration, so then you're not coughing, but it's still going in, and we can't tell that, so you would need to get a swallow study. So there's levels of food that you should have. I actually, at my job the other day, had something really cool. One of our therapists is only in a couple days a week because she has a kid. So she brought her baby in the other day because she loves feeding therapy. She's really good at it, and she brought in her baby so we could see what a typical feeding session would look like. It was really cool. So then I was like, okay, now I feel a little bit better talking about this. So one thing that she would do, I thought you were raising your hand. One thing she would do is make sure that the kid was putting the food on the sides of his mouth. Chew over there, move it, get the skill to move it over to the other side, and that's how you get that nice shape to make it easier to swallow. She'd start with crunchy foods and then put soft foods in it, and then back to crunchy to explore different textures. It's a little bit more satisfying to chew that crunchy stuff, which I'm sure you guys can relate to. You'd rather eat like chips than a pear because it has that crunchiness instead of the mushy, but it's nice to go back and forth between the textures. And just make sure that you're putting it in the right spots. And then you follow a hierarchy. Did you guys ever have to try thick and liquid? Yeah, that was something my teacher made us do too in class because it's gross. It's not something that you like, and my teacher made us try it because it's easy to just stick them on thick and liquids for the rest of their life, but that is not enjoyable. So you need to be mindful of what your patient's having and try to have them have a good what's the word I'm thinking of? Quality of life. That's it. You have to think of their quality of life with all this because food is such an important part in everybody's life. Like, yeah, you can have your NG tube and you get your nourishment, but food, there's so much more to it. There's the social aspect of eating. I remember in grad school, if you're on a feeding tube, you can still have it at the dinner table and you can still sit with everyone and still have it be a social event because that is a huge part of who we are as humans is we like to be social and communicate. So that's my little intro about feeding. So then there's feeding hierarchy too. So that's something that you guys definitely deal with the OT. We'll have some feeding kids come in sometimes. And with us, we're teaching them all the chewing, the swallowing, all of that good stuff. The OTs have been work on this, a lot of stuff. So it's tolerating it on your plate, tolerating a certain color of food, the textures, the feeling, the wetness. So you work your way up from, maybe if you can touch it, smell it, kiss it, lick it, bite it, chew it, swallow it, and then you can do like a little mouse bite or a shark bite. So it's just cute. It's cute. It's nice. It's not something I ever want to do, but maybe I will. Okay, so now that we are talking about all this chewing, I know a few of you did it yesterday. Have you guys ever been on a plane?
Yep.
Okay. What is one tip that people always give you to do on a plane? Chew gum. Yes, exactly. Because in your ear there is the eustachian tube that's like right here. As a baby, they're horizontal, and your whole thing is connected. Your ear. So I took so many classes on audiology, which we will talk about in a few minutes. But your eustachian tube is something very interesting to me. When you're chewing, that's making that open and close, open and close. So when you are on a plane, you chew the gum so that you can relieve some of that pressure and your ears don't pop. So I just thought that was a cool thing. When you are a baby, you get frequent ear infections because your eustachian tube is horizontal. As you grow, they slowly move down. But when you're a baby, so if you're feeding a baby, their head's like all the way back, not tilted up, then that milk will go into their ears and pool in there. Very weird, but it's connected. So that's why, like, if you're feeding someone, they shouldn't be there. They need to be tilted up a little bit so that it gets connected. That's not the only reason why. Like,
Right.
they're getting an ear infection because you're feeding them wrong, but it's because of the shape of their eustachian tube. So it's easier for liquid to pull up in there. Whereas as you grow, it gets a little bit,
Who's learning new
straight.
things today?
I'm so happy to hear that. So yes, here it is, that eustachian tube right there-ish. Yep.
Yeah.
Okay, so there are 3 different parts of the ear. There's the outer, middle, and inner. The outer is what everybody sees here. It's called your pinna. And that's what funnels sound in. And then there is the middle ear and the inner ear. So the middle ear, this is very blurry and I apologize. There's a lot of different stuff in here. That is where your smallest bones are. So there's 2 different types of hearing, and there is, I'll go back to this one because this one's a little easier to see. So there's your cochlea, and then there's all the innards in here. So when sound goes in, that is air conduction, and that is all of the particles and stuff being funneled into your ear by this outer portion of it. As it goes in, it goes through a lot of different stuff, and so it starts out by hitting the eardrum, right? Those are 3 different bones that are very tiny, the malleus, incus, and stapes. So then they're moving together, and it's hammering on, and then there's a hole, and it's very, bear with me. So then it bounces this way, it bounces that way. Then there's like a pool of liquid in it. And then you're getting those waves in the pool. And then the pools move it in, and then it sends more air and moves stuff back and forth. Then down your cochlea, there's inner ear hair cells that are going back and forth as you're doing this. If it's too loud, they get stuck down. It's a toothbrush. If you cut those off, they do not come back. So that's why you need to take care of your ears. I went to a lot of clubs when I was younger. I'd be in an audiology class and see the bouncer with earplugs, and I'd be like, great idea, good thinking. Because they're in that loud place. My mom works at a concert hall. I'm like, Mom, protect your ears. Be careful with that, because then you might get that phantom sound. Has anyone ever been somewhere noisy? You come out, your ears are ringing. That's called tinnitus. That can last. That can haunt people their whole life, which is horrible. Like, they can just hear that the whole time. But then, so they all work together. There is, has anyone ever seen a cochlear implant? I have stuff about that a little bit later, which is where we're getting to. Okay, yeah, this is what I was talking about. So there's the bone conduction and air conduction. Air is when it's going through here. Bone is when it's in the cochlea and stuff. So you can feel like a big bone right here, and that is where the cochlear implant would be placed. My coworker the other day got headphones that you can put behind your ears, and then it's bone conduction. So instead of like going through all of here, it just automatically goes right to the nerve and sends it to the brain.
My husband has ones like that.
They're very cool.
Loves them.
I can't wait to try them.
So much better. I was like, you're not wearing them in your ears. He's like, this is how you wear them.
Well, when you wear them in your ears, I'm sure, has anyone ever cleaned your headphones?
Oh, sick.
Yeah, they're disgusting. Like, your headphones are, I hate putting them in. I usually wear over the ear because they just get disgusting and dirty, and people have also, you don't know how, does anyone have any guess on what the most common thing people get pulled out of their ears are from the doctor?
No, what?
Cockroaches. Yeah, like they can just nestle in there. I saw pictures of ears with like blue mold in them. I'm like, ew, ears are gross. Take care of them. Clean your headphones. If you learned anything today, clean your headphones.
What a fun Jeopardy fact.
So, yeah, just be careful of that. It's disgusting. It's gross. Ears are interesting. But yeah, so there's the hearing aids. There's a bunch of different kinds. You've probably all seen them. And you can connect them to your phone. You can kind of control what you hear. And then there's the cochlear. So you would need, let's see, do I have it on here? Okay, so there's the different types of hearing loss. There's the sensory neural, mixed, and conductive. So sensory neural is that bone conduction stuff. Then the conductive might happen, like you might have that hearing loss because you have too much earwax. You might have something random in your ear. You might have liquid in your ear. So that is what you would use a hearing aid for, to control that sound, funnel it in, amplify it, send it in. The sensory neural, you can't hear anything as much, and that's more of the, sensory stuff. It's got
That's like degenerative hearing loss.
Exactly.
Right?
So as you get older, you'll lose it, or that noise damage, you're aging. And then, somewhere in between might happen because of genetics, infections, or head trauma. All right. So that is everything I've got to say about my stuff. Now we can get into a little bit of OT. We've kind of already gone over this a lot, but some of the people you guys might work with are feeding, cognition, language, posture, and swallowing. We do a lot of the same stuff. We work with the same kids, work with the same adults. We work together, so make sure that you're always a team. I have a clinical practice activity for us to do. We can do that after I give my final remarks if you'd rather.
Yeah, let's do that.
So this is a quote my brother always has liked, but nothing of me is original. I'm the combined effort of everyone I've ever known. And I really wouldn't know any of this stuff if I wasn't surrounded by really great people. I'm surrounded by amazing coworkers that I'm thankful for every day. I had fabulous teachers who've really helped me along the way, so be very grateful for your teachers because, it's not an easy thing to do. It's hard to have such complicated things and put it down into such simple ways that you'll remember for a lifetime. I learn stuff from my students every day, the parents, and they learn a lot from me, and the impact that you can make on somebody is pretty amazing. And my advice to you is never be afraid to ask for help, whether it be a coworker, mental health, or mentor. This is a big job. You can get really stressed out. I know you guys are kind of at the end of your track, but if you're very stressed out, I know that your big exams are coming. It's all very stressful. My school had a mental health clinic, so if you need somebody to help you during this time,
We do too.
I really recommend doing that. Nothing to be ashamed of. It's just hard. This is hard stuff. It's heavy. You're dealing with a lot of other people's stuff that you have to be able to compartmentalize and separate yourself from it and just move on and still be yourself, while still thinking oh, well, I could help this person by doing that. So it's just a lot. It's very stressful. So that brings me into work-life balance. You need to set boundaries with yourself. You're more than your work. You guys are going to be doing you guys have already been doing a lot of work, and you're going to continue to. As you guys keep studying, make sure you guys take care of yourself. Keep learning and take care of you. Work out, eat good food, pack your lunch. Just make sure you guys are taking care of yourself. So thank you for your time. I'd like to end it out because I wrote down a little description of 3 of my students. I changed the name to my brother's names and my dad. So not we're breaking any rules here, so I just did a little description of each kid. One child, I must just said his real name, sorry. He is very interesting. He has an AAC device at the clinic that that is ours, and he can come in and use it. His dad's in the process of getting him one. I'll give you a little OT description, then I'll give him to speech. He gets very frustrated when you're playing. He's very particular. He likes to set up train tracks. He likes to do it here. His goals with me are to follow directions, expand his language, use the device, identify actions. And with OT, it's turn taking, letting people impose on his play. So that's the first one that you guys can look through. The second one is a child who is feeding for PT, and he gets very stressed out when he has to eat. He doesn't eat anything, and he is a huge scripter. He just scripts all day. He says all sorts of stuff. The first time I met him, he was like, first things first, shake Spider-Man's hand. And I'm like, hey, nice to meet you. So he has to do feeding, and for speech, he isn't doing feeding stuff. He just has to, use descriptive words, make requests and comments. And then my last one, this one was very fascinating to me, and I just redid his AAC device. He is about 12 years, he's 11 too, and he gets very frustrated. He's a hygiene kid. He has a lot of ALD stuff, he scripts. He mostly responds in 1 to 2 word phrases, and he had an AAC device that was like a million things on it, but I just redid it so he has 6 buttons on it that are, I feel excited, I feel frustrated, I need space, because that's something he says all the time. So he's one of those ones that is working on protesting. So if you guys all have one, you can at least pick one kid to go through and see what you would do. But so yeah.
I gave out a couple of different, I'm going to have them each work in pairs. Okay. Work in pairs or a group of 3, whatever you guys want to do. And then once you're done, we'll chat about the differences between who has case 1, who has case 2, who has case 3.
Okay.
Cool?
Cool.
Cool.
Good stuff.
Awesome. Well, actually, I should read these and figure out what I would do.
Yeah, let's see.
Oh, yeah, definitely 11 because
I would be
showing
like,
up to do.
help. Help with this. How would you manage your time? So you have 15 minutes.
These are 30. But the school is 15. But for, that's interesting, for OT it's 45 or an hour. So if it's at before 3, it's an hour, but if it's after 3, it's 45 minutes. But speech is only 30 minutes. So OT like really needs to utilize their time with the speech therapist.
Right, in order to.
And sometimes they try to like separate it and they'll be like, okay, what do you need to do? I'm like, nothing. What are we doing?
What are we doing together?
Yeah,
Right.
exactly.
Well, yeah, because I mean, if we're talking about position, turn taking, we can use the AC device to communicate. Like, no, those kinds of things, especially if verbalization is an issue.
With others.
And then also, I would probably want to work on him using the device and then also repeating whatever the device said. So maybe you're the enforcer of that, and
I just don't know
what kind of game are we going to play? Potentially, I would maybe just do like a
I guess like
Oh yeah, they do this all the time.
just a little obstacle course and then yes. Which one is Tom?
Tom.
Tom is the third. Yeah, I would want to do an obstacle course. One other kid.
And we are only one kid at a time.
Only one kid at a time. Okay, so then I'm the other kid.
Yeah, that's the thing. It's like since you have both, one can be the person putting in the commands, the other person can be doing that.
Right. Right. So then I'm the kid with him. Mm-hmm. Like that.
sorry, I keep turning it.
It's cool hearing all about it. I'm excited to bring the info back. Because these were like my kids that are trickier too. That I was like, I'll see what everyone's gonna say.
Exactly. Crowdsource, like I do that all the time. Like I have a difficult case, like what would you guys do?
Right?
And they're like,
This kid
it
is
builds
very
like that
talented.
self-efficacy of like that's using their critical decision making, but then also like I'm asking you as an almost colleague, because you're going to be a colleague like in 5 months. So
Yeah. Yeah, when I said when you're older, I'm like, when you're older now.
in 3 months. Totally fine. 11-year-old boy on radio. 11.
I thought it was nice too because there was like a good range of like ages of kids to talk about. But yeah, this kid is a tricky one, and his dad's like, I don't know what to do. Like, I think I need to get educated or something because I don't know enough about autism.
That would be a great place to start.
Yeah.
That would be a great place to start. That being said, every kid is so individual. Like, knowing a little bit more would be helpful, but like knowing about his specific elopement makes me really worried for
He
his
curses like crazy.
for his safety.
And like we'll be aggressive, and like, we have a lot of different rooms, and we'll just like run and open all the rooms and like scream in other kids' sessions, and we're like, please stop.
1 to 3 word phrases. Okay, so he has scripts. I would want to know. I would want to somehow organize his language. Not necessarily using a device, but like, what are the scripts that you use when you need something? The scripts that you use when you right? And so like, this is what you say when you're frustrated with this or whatever. Giving him those options, like, or even like, here's your list, point to.
Which could be nice on the device, because then he could do it.
Yeah.
So like, so I liked on his, like as I said with the younger kids, you need to like more words to string together for him. I was like, let's just give him a button. I need space.
Right.
I need space. Because now he's not
So much. Yeah.
too much. I need space.
Right.
I feel a problem. So I just started out with the 6 because I just wanted to get a baseline and then I could add some more as I went. And I told the parents how to do it too. So
I like that. I like that.
yeah, he's a tough one. Sweet boy though.
I would also want to give him an outlet to be aggressive, to run around, to act these behaviors out in a safe way. So
And
like,
it's so tough because like I want him to communicate what he wants,
right.
but then he has to go brush his teeth and he like has to brush his teeth because he has to. I don't want to. I need space. I need a break. And I'm like, okay, first teeth, then break.
Yeah.
So it's hard when you're trying to honor it, but then they have stuff that they need to do for OT.
Right.
Because as soon as somebody says I don't want it, I'm like, okay. Then the OTs will be like, you need to do it twice, do it twice.
Right.
And I'm like, that's the goal. So
Yeah.
So it's tough. So you really have to work together.
Yeah. But even so, like, I'm wondering if we allowed something like this first, right? We create some sort of jungle gym situation. He has to like escape the room kind of thing.
Yeah.
He has to use his brain and the skills in the way that he wants to use them, and then we do the hard things, right? And he's already
Wow. Interesting.
But
Yeah.
you also might be reinforcing some behavior, so you have to make it like, this is game, this is not what we do, right? But, or even just like, yeah, again, some game where he's allowed to yell and scream and play and like get out. Because I'm sure, especially if, and you could probably speak to this more than I can, but being 11 and only being able to communicate in 3 words is incredibly frustrating, right? So how much do you feel trapped in? And you just want to
Yeah. So now he just learned like I need space, please. So like,
Right.
whenever he's frustrated, he'll just like take everything like it's space.
Right.
Right. Sure.
Okay, that's a good tool, but
Yeah.
also
Yeah, but like let's think of more stuff to say and how to do it. Yeah, it's tough.
yeah,
But that's a great idea.
yeah.
What's this class about?
What's that?
What is this class about?
I just wanted to leave a little 15 minutes at the end just in case they wanted to, or we're brain dead.
Yeah.
All right, friendos. Can we bring it back together and chat a little bit? So, who had Jack? Raise your hands if you had Jack. Jack. Cool. So, tell me what you thought some goals would be for Jack, and then how would you involve Mary, your new speech language pathologist friend? Yeah.
So our 2 goals were Jack will be able to take 3 turns with minimal prompts, and then Jack will improve AAC device efficiency throughout the entirety of the session.
Like it.
So to include speech for the co-treat, we said during treatment, speech would be included to encourage appropriate verbal output, such as like building correct verbal statements, like the example of like one Hank, like at least being able to say something to like give us like a chance to understand what he's trying to say, like maybe my turn, so that we can like gauge how
I like that.
he's able to like play the games and stuff.
I like that. Second goal, how would you make that measurable?
That was we were talking about that.
What was the second goal again?
Measurable, but
Improve the use of the communication device, or the accuracy of use of communication device within the session.
I think it would be more so like, that's just like a vague one, but like a short-term one would be like use the, like he said it was used only like once to imitate 2 words. So then like to improve that, it would be like use twice for 2 words and then like keep going up.
Mm-hmm. You can also do like a percentage too, is like out of opportunities, which is nice. One thing that like is going to be a little nitpicky that like I don't know if you agree with, but a couple of my professors hated the word able. So like in goals, like they will be able to, like it's just they will do it because they're like, what does able even mean? So like they were able to, they did.
So caveat for us, we do need ability because we do ability by level.
Interesting.
So with modified independence, with independence.
Yeah.
So we talk about what level of ability they're actually at in terms of being able to provide. But it's nice to know that, right?
Yeah.
So when you're reading a speech note, you're not going to have that ability level. You're just going to, that's their goal is to do it.
And then we will say like with moderate support.
Okay, yeah.
With visual feedback.
Right. But
Interesting. Yeah.
Cool.
Very good. Liked it.
I like it. You guys have something different?
We didn't really put our thing into like a coast format or anything. We were
Totally
kind of
fine.
talking- I had a good idea about like impulsivity because that could kind of be sort of addressing sort of the sensory processing side and just really helping with that emotional regulation and then turn taking.
Cool. So a goal around impulsivity. And then how would you work with a speech therapist? How would you utilize their skills versus yours?
Yeah, so I think kind of similar to what they said, sort of incorporating maybe adding more phrases to like their AAC device because like he's almost forced to only say like 2 words at a time that may be kind of limiting for him. And so maybe sort of enhancing some of the terminology if you think that's appropriate. So he can communicate better.
Cool.
And then another thing we mentioned was kind of like if there is sensory processing during feeding, there might be sensitivity while swallowing or chewing or anything like that. So I'd consider maybe assessing that.
Working on that or assessing that. I like that. Awesome. You guys.
We were very similar to theirs. We had a goal to increase like turn capability, and then to add speech into that, we would they could work on like using the AAC for that turn taking and like verbalizing the frustration through that. And then also we had the goal to increase the independently hitting 2 bits instead of the 1, and so it was very similar.
Cool. And then what activity did you think of to do with this particular client? Did anybody think of what they might do in terms of a session?
To preface, I have a toy garage at my job with every single toy, every single game. We've got Potato Head, we've got Lego. So if with this choice, you really have anything. So that makes it a little easier.
What do we think? That was crazy.
Yeah.
It's the ghost. One thing that, oh yeah, go ahead.
I don't know, like they were kind of touching on impulsivity, and I know a lot of times we use some things as simple as like red light, green light, or like something says like, well, red light, green light might be a little bit easier because it's kind of like less like longer sentences and words, so it's like just brief, like red, green, yellow, like you could kind of just say that and they could understand.
I like that. I like that. Something that I thought about was maybe doing like a what's it called? Obstacle course, where I would use Mary as the reinforcer of you're going to use your communication device, you're going to repeat whatever the communication device says, but then I am the playmate and we have to take turns doing this particular course, right? And so as I'm going through, maybe I'm talking out what I'm doing, but then he has to work on that frustration tolerance and wait for me, right? And then if he is frustrated, I have my enforcer to be like, use your words, let's use your device, right? Cool. All right, group 2, Patrick. Who had Patrick? Yes. Tell me what you guys thought about Patrick.
So we said the client will utilize his AAC device when he's frustrated to improve communication skills in 2 weeks, and then he will use his AAC device to choose 2 new foods during feeding in the next 2 weeks.
Cool.
This child, not to like be rude or anything. He doesn't have an AXE device. He is just a scripter all day. He just says like all these different phrases. So he doesn't actually have a device. We could have one present just because we have one kept at our office, but that's not something that he really works on.
Cool. That's cool. Anybody else have Patrick? Yeah.
We also did ours in like specific format.
That's
We
okay.
said like being able to communicate food preferences with like restricted phrases, so like getting the social registration of it.
Mm-hmm.
And then also since he was previously doing like the food to the mouth and like kiss, like take a bite stuff, tolerate like his preferred snacks that we already know that he likes, and then moving back to that and like maybe incorporating like self-regulation techniques if he gets like upset or frustrated.
Yeah, I like that. I think that sounds really good. I like the idea of using what he already, skills that he already has, strengths that he already has, foods that you already know that he likes to build those skills. What kind of intervention would you want to do besides feeding with somebody like Patrick?
I was thinking like sensory supports, maybe like during feeding, so
Mm-hmm.
like he can regulate himself during tasks.
Cool. Cool. Like what?
Like use of like fidgets or like deep pressure or something.
I thought about like a weighted vest, just to see. What does this do? Do you like deep pressure? Is it good for you? Is it too destimulating? Yeah.
That's a good idea. We just got a new one of those.
Hey, think about it. Also, especially is he one who like tries to like run away? No, it's not.
No, he just gets like annoyed.
Okay.
And he'll be like, no.
Yeah.
Yeah.
Just something to bring it down a little. Yeah, Allie. Yeah.
One thing that I do with him is one of his goals is to use 3 attributes to describe something. So a lot of times during the sessions when it's not me, he will be doing his feeding stuff and then he'll take a break and go to speech and do stuff separate and kind of make it 2 different things. But when I'm in there and he's eating something, I describe the food. So I'll be like, all right, is that one crunchy or mushy? How does it smell? And like, what's it taste like? Is it sweet or is it sour? Is it salty or is it sugary? So that one has been pretty fun for me too.
That's good. Good exploration. Also, if anybody's into Jerry, this is kind of stuff that you can do with Jerry, obviously modified, but a Jerry population as well. When people are really are losing certain senses and want to revisit certain senses, it's a really good calming activity and a nice recentering activity. I'm thinking of like for my Alzheimer's patients, really loved like orange peeling and just talking about all of the memories, the senses that are stimulated when you're peeling an orange. Just, I have the chills just thinking about it. Yeah. Okay. Last but not least, Tom. Oh, your dad.
That's my dad.
I was like, brother, dad. So who had Tom? Tom. So what did you guys, Tom is our 11-year-old, right? So we are working with an older child here. So how did we modify, or what did we end up wanting to work on with Tom?
We kind of said like sensory regulation, like transitioning and like taking turns and stuff, because
Mm-hmm.
and like his ADLs.
And his ADLs, right. What did you guys say?
Also his ADLs, but and similar, we said like self-regulation.
Mm-hmm.
Not specifically like sensory, but just in general, like when he has those moments of dysregulation and outbursts.
Mm-hmm. Cool. So how would you co-treat with a Mary for your client Tom? Yeah.
We said kind of similar to what you said earlier, like having the OT as like the playmate, and then the speech developers could be like the kind of like guiding the conversation. I mean, I guess both could, but like making sure that it stays on topic and things like that.
Okay.
Like transitioning.
Cool. And then what are you doing with this client? What is the activity? What is the occupation?
Like social play.
Social play? Okay, so what are we doing for social play for an 11-year-old? An 11-year-old with 1 to 3 word phrases and scripting. Anybody can answer. Yeah.
I was thinking like playing a preferred sport. Whereas if it's like basketball, if he's like doing 2 or 3 words, like pass ball, pass the ball.
Cool. I like that. What else? I also really like that because he has elopement tendencies and aggressive outbursts. So I like something active, right? What else?
Or even some sort of like game or an obstacle course, or like incorporate a game into an obstacle course and a sport kind of that's preferred for the patients or the clients if they're more motivated, interested, motivated to participate.
Yeah, so we're talking like gross motor, getting your heart rate up, but also working on those regulation skills at the same time. Yeah.
Something that's like opposite of that and more like just relaxed sitting and still trying to like work on that regulation and the outbursts in moments where like playing a game if he gets dysregulated and he's not winning or it didn't give a lot of details so I don't know the specifics but you could play like Go Fish because that's a simple game like simple phrases can be used during that game like have Jack or have 10 or something like that like Go Fish like the whole phrase is just 2 words anyway.
Love that.
Very good.
Yeah. Cool. Anybody else? Awesome. Any thoughts on that one?
Loved it. I thought that was good. He is a little bit more tricky because he doesn't really like to play stuff. We have this one game that's like Angry Birds and you build up the tower and you slingshot and knock it over. He doesn't want you to play with him. He kind of will just like take all the pieces and want space, back up, and like if you play it, he'll be like, mine now. Sad time. Yeah, he always says that, and he'll be like, all right, like you have to go brush your teeth. Sad time. No, you gotta go. So we've been more. So his device originally was one of the ones I was talking about that had like 1 million buttons on it. He'd come in and throw it on the ground and keep walking, like never using it. So then I just made it have only 6 buttons on it, so that we can slowly add more. And it's I need space. Can we have a new toy? And for him, as I was saying with the younger kids, it's better to have the AAC devices to build your sentence structures. But since he doesn't really use it and he gets pretty frustrated, I just loaded phrases into it so that he has, and since he gets so irritated, it's better that he can just have quicker access to it and encourage him to use it a little bit more. So we're slowly adding some more stuff. We were just talking, saying it would be good to add like a couple of his script phrases into its whole new category. To get him going, but he's an interesting one. He doesn't come in until usually like 7:30 p.m. at night. So he goes to school all day and then he comes there at night. So some of these are a little difficult. So yeah, I only put a limited amount of information on here because that's all you could really fit. But there's so much more to these people than just their tiny little paragraphs that you have to consider. Like he could be doing great if he comes in at 4, but then at 7:30 to 8 p.m. he is ready to go. He's exhausted.
Right.
So it's very interesting.
Right. Well, the thing I'm immediately thinking of is like 7:30 to 8 p.m. That's usually like if I was at home, I would be having dinner or being able to relax on the couch. How frustrating it to have to literally run a marathon all day by going to school as a neurodiverse child and then have to go to another appointment, have your free time messed up. That's frustrating, right? And to not be able to communicate how frustrating that is and only have or running away, right? So now that I know 7:30, I would be like, can we do a whole, does he like eating? Have we tried eating with him? Is he motivated by food? Can we make dinner together? Like that's what I would want to do. 7:30, like come on in.
Kids, I'm like, you want to watch a movie?
Right.
We like will lay in a beanbag and watch a show, and then I'll pause it and be like, who was that? Who was on the train? And like so because sometimes they don't want to play, they don't want to do stuff, so you